En 2006, Junichiro Koizumi, alors Premier ministre du Japon, était en visite au Ghana lorsqu'un nom lui est venu à l'esprit. Celui du docteur Hideyo Noguchi. Hideyo Noguchi, qui travaillait à l'Institut Rockefeller, fut le premier médecin japonais reconnu sur le continent africain. Il se rendit à Accra, au Ghana, pour ses recherches sur la fièvre jaune, mais mourut malheureusement de cette maladie quelques mois plus tard. C'était en 1928. Il n'avait que 51 ans. Si la santé publique et la science médicale ont beaucoup progressé depuis, de graves épidémies de maladies infectieuses sévissent encore en Afrique et ailleurs. Estimant qu'aujourd'hui, plus que jamais, la mission de Hideyo Noguchi doit être poursuivie, M. Koizumi a institué un prix qui récompense les individus ou les organisations ayant réalisé des résultats remarquables dans le domaine de la recherche médicale et des services médicaux, et ainsi contribué à aider le peuple africain. Baptisé Prix Hideyo Noguchi pour l'Afrique, il est comparable au prix Nobel.
本当に嬉しいことで、日本がこういうことをするのかということで、さらに評価が高くなっているのは間違いないですね。日本がそんなことしてくれたのっていうことで、ものすごく喜んでいるということが、会う人ごとに言われるので、もう本当に嬉しいことだと思いますね。受賞した人方々の喜びの声がね、やはり周りに広がっていくことこそがね、そういう人たちがやはり日本のことをパートナーだと思っていることがすごく嬉しいなと思います。これはもうぜひ続けてほしいし、こういう形のものをね、やはりこれからも小さくてもやっていくことがすごく大事じゃないかなと思います。
実は今現在もアフリカでもう2億人3億人かかるような病気っていうのは普通にありますし、先進国では感染症がなくなったように見えるけども、実はアフリカではまだまだ多くの人たちが治療すれば治る、予防すれば感染しない、そういった病気っていうのがまだまだあるんですね。その健康、ヘルス、医学っていうものに焦点を当て、でまたその研究開発と実際の医療活動をしている2つの面で、きちんと素晴らしい方に賞を与えるっていうのは、これは素晴らしい特別な賞だと思います。
La cérémonie de remise du prix Hideyo Noguchi pour l'Afrique a lieu lors de la TICAD, la conférence internationale de Tokyo sur le développement de l'Afrique. Et voici les lauréats de cette 5e édition. DNDi, initiative pour les médicaments contre les maladies négligées. DNDi travaille depuis sa création il y a 22 ans avec des partenaires internationaux pour développer et mettre à disposition des traitements sûrs, efficaces et abordables contre des maladies négligées telles que la maladie du sommeil. Ces efforts ont un large impact et contribuent à l'amélioration de la santé publique dans les pays à faibles et moyens revenus. Par ailleurs, DNDi joue un rôle central dans l'organisation, dans des zones souvent reculées, de recherche clinique répondant aux normes internationales les plus élevées. Par exemple, DNDi coordonne la plateforme Trypanosomiase humaine africaine, maladie du sommeil, qui rassemble des institutions et des experts des pays africains endémiques.
This prize is shining a light of millions of vulnerable patients and communities around the world. In a world where global health is less and less supported at the international level, we see this prize as a strong commitment and strong support from the Japanese government all around the world. More specifically, in continents like Africa, where we see neglected tropical diseases having a big burden for communities, we have done great achievements. A very good example is sleep and sickness all around the African continent. We are working in other neglected diseases like visceral leishmaniasis. Many other diseases deserve our attention, but the most important is to bring the best science for the most neglected patients.
Le docteur Abdoulaye Djimdé. Les 30 années de recherche du docteur ont fait progresser le traitement et la lutte contre le paludisme, influençant les politiques de santé en Afrique et à l'OMS. Ayant perdu son frère du paludisme enfant, il s'est consacré à la recherche contre cette maladie qui menace les populations africaines. Le docteur s'emploie toujours aujourd'hui à concrétiser son rêve d'une Afrique sans paludisme.
On the clinical development side, I'm working on novel classes of antimalarial drugs. Currently, the main drug is artemisinin, and there are cases of partial resistance in East Africa and in the Horn of Africa. So we need to be prepared and to find a new class of drugs that would work should the parasite become resistant to artemisinins. That is really information that there is no more reward than hearing villagers say that since you started working in the village, children are not dying anymore. That's the kind of moment that keep us going. So my intention is I'm already planning on ways to invest this funds to bring more opportunity to more young scientists to be trained in basic science, so that one day, in addition to testing drugs that are invented by others, our young people can invent new drugs and new vaccines to fight diseases in Africa.
Voici les lauréats des 4 premières éditions. Professeur Miriam K. Depuis plus de 40 ans, le professeur Miriam K consacre sa vie à l'amélioration de la santé et du bien-être du peuple africain, en particulier les femmes et les enfants, et à l'extension de l'accès aux services de santé de base pour les communautés.
Currently the Chancellor of Moi University. Since receiving the prize, I have been invited to many other bodies. I am a member of the Champions for AIDS-Free Generation in Africa. My focus has been on community health. We must focus more on promotion of health like nutrition, as well as preventing disease, such as through immunization and through hygiene. And this is one way that Africa can control how much money is spent in the health sector. So I would like to encourage young medical researchers and young medical service specialists to really be committed on health prevention, health promotion, as well as being good clinicians to provide good services to our people. Hospitals don't change health, they treat disease. Thank you very much and best wishes.
Professeur Brian Greenwood. Depuis plus de 30 ans, le professeur Brian Greenwood travaille en Afrique et œuvre à la mise au point de stratégies efficaces de lutte contre le paludisme et autres maladies infectieuses.
So I'm very honored to be one of the 2 first recipients of the Hideyo Noguchi Prize, and I'm very grateful to the government and people of Japan for establishing this prestigious award. I considered how best one could use the considerable sum of money that comes, prize money that comes with this award. I thought that the best thing to do would be to establish a scholarship program for young African scientists that would allow them to undertake a master's degree. During the past 5 years, over 4,000 applications have been received, and it's been possible to make 30 scholarship awards.
Professeur Alex Coutinho. Le professeur Alex Coutinho est un pionnier en matière de développement de l'accès au traitement contre le VIH en Afrique, continent où vit 70% de la population séropositive mondiale.
I received this prize in recognition of the work that I and many others had done in scaling up HIV services. Since I received that prize, I have now applied the knowledge that I have accumulated over 35 years as a doctor in scaling up medical services to new challenges. It's important that prizes like the Hideyo Noguchi Africa Prize are supported and encouraged, because it will encourage the younger generation of Africans who are coming up in the field of research and medical service delivery to aspire to one day also be recipients of this prize.
Professeur Peter Piot. La carrière du professeur Peter Piot a démarré en Afrique, où il a été le premier à identifier le virus Ebola, il y a 40 ans, et ses travaux ont permis de porter le VIH-Sida au rang des grands problèmes mondiaux.
Receiving the Hideyo Noguchi Africa Prize was definitely one of the highlights of my career. In the first place, because Dr. Noguchi is a truly universal role model for all of us in global health. And I trust that the prize now will attract the best of Africa's researchers so that their work can receive all the support that is needed.
Dr Francis Gervase Omaswa, pour sa contribution à la réponse à la pénurie mondiale de professionnels de santé par la formation et la stabilisation du personnel, ainsi que pour la mise en œuvre de systèmes de santé et de soins fondés sur les ressources humaines en Afrique et à travers le monde.
Since the award, I have continued to work at the African Center for Global Health and Social Transformation, focusing on strengthening health systems in Africa, community health services in particular, and also on strengthening human resources capacities in African countries and creating movements here in Africa which support health workforce. Part of the money and the substantial amount has gone towards building, constructing an institution which is named in memory of our daughter who died in her early 30s some years ago. It is called the Gervase Omaswa Health and Community Institute. It is intended to support strengthening of health systems and educating and training new generation of health workers who will contribute to strengthening health services, not only in that area, but also in the whole of Uganda and Africa.
Dr Jean-Jacques Muyembe-Tamfum, pour sa contribution à la recherche et à la formation en matière de lutte contre les maladies, en particulier la maladie à virus Ebola.
So the Hideyo Noguchi Prize remains a great symbol of the visibility of African research. And this visibility is a stimulus for future generations of young scientists. The most important areas of my research is Ebola, and also the second field of activities was Mpox. Mpox was a neglected disease in DRC. It was an endemic disease in DRC that was neglected. But since the outbreak of 2022, the multi-country outbreak, Mpox was declared by WHO as a public health emergency of international concern. So we conduct pioneering activities on this virus that is now public health emergency of international concern.
Programme d'éradication du ver de Guinée. Pour la quasi-éradication de la maladie du ver de Guinée sous l'égide du Centre Carter et en collaboration avec diverses organisations.
I think it would be an understatement to say that the Hideyo Noguchi Prize awarded to the guinea worm eradication program and the Carter Center has been a phenomenal change maker in helping push the effort to eradicate guinea worm disease globally forward. The success of the global program to eradicate guinea worm in part makes it difficult to finish the job because we went from 3.5 million people each year with guinea worm to only 13 people at the end of 2024. So now you are really looking for a needle in the haystack as you try to make sure that this disease cannot come back and attack people. And so it's thanks to the Hideyo Noguchi Prize and the people of Japan that we were able to push that forward.
Dr Salim S Abdool Karim, Dr Quarraisha Abdool Karim, pour leur contribution à la prévention du VIH et au traitement du sida dans le monde, à la formation de chercheurs africains, ainsi que pour leur engagement dans la lutte contre la Covid-19.
It's a great way to affirm and acknowledge his contributions, but also that this prize is focused in Africa, where it made significant contributions, and to recognize African science and excellence is deeply valued in Africa, showing the role African science is playing not only in addressing challenges in Africa, but also globally.
In addition to continuing our research on HIV, we now play an important role in supporting a range of different initiatives, and one specifically right now is on the Mpox situation in Africa. We are involved in Mpox research and supporting the Africa CDC in their efforts to respond to this problem before it becomes a major global challenge. The Hideyo Noguchi Prize has played an important role in our research. It has funded our research on broadly neutralizing antibodies, a way in which we are developing a new technology to prevent HIV, and it has funded several students who are now doing higher degrees and developing themselves as researchers in Africa.
Le Japon continuera à promouvoir le prix Hideyo Noguchi pour l'Afrique et à appeler à une coopération internationale pour améliorer la santé et le bien-être sur le continent africain. Dans cet objectif, il continuera également à exercer son leadership dans le domaine de la santé mondiale.